Welcome to Hillsdale Hospital Live. I am your host, JJ Hodshire, President and Chief Executive Officer. And today it is my privilege to have in Lansing my good friend, a colleague, and someone who is certainly not new to this program, Laura Appel. She is the Vice President. Executive Vice President, by the way, recent promotion, congratulations. Executive Vice President, and that is over quite a few departments within our Michigan Health and Hospital Association, also known as MHA, Michigan Hospital Association. Laura has been an absolute champion for rural healthcare and for healthcare in general, but I tend to, focus on the rural part of it. But she is a tremendous voice for Michigan hospitals, fighting Lansing, Washington, and just about everything in between. So it is great to have you again on the program, Laura. We have a lot to talk about today. But for our listeners, a brief introduction, if you would please, of your background. And I know you've been here many times, but in case we have a new viewer, would you please go over that?
Sure. Thank you so much, JJ. And I just want to point out to the folks on watching that JJ is a member of the Michigan Health and Hospital Association Board of Directors and does a fantastic job there representing hospitals generally and Hillsdale as well. And we're lucky to have him to work with. So JJ, I came to the MHA many years ago from the state legislature where I did policy work. But you can't really spend any time in the state legislature without understanding an awful lot of the politics that goes on, because you don't get any policy done unless you deal with the politics. And after I completed my work there and came to the MHA, I've gone through a series of roles here, all with always maintaining the, hey, what is it that we're doing that needs to be done differently? What is it that we're not doing that we need to do and need authorization to do? Or what is the new problem that we have or issue that's arisen that we need policies to adapt to? And a great example of something like that is, like, right now we're in the middle of this whole conversation about artificial intelligence. So developing, when people are like, well, what is policy? Policy is developing the rules around how we're going to do something. And AI right now is a great example of people trying to figure out, what are the guardrails for using that new technology or newer technology, because in healthcare, AI has been in place for years, and we've got lots of ways we already use it. So that's just an example of what policy work is, and of course that incorporates politics, the government relations work we do, as well as public affairs, like how's the world perceiving hospitals generally? The general public, our lawmakers, the media. Decision makers, et cetera. So that's what I do here at the MHA, and I'm very excited to be here with you today.
Yeah, and it's so great, obviously, to be able to connect with you today because, we're coming off of a pretty tumultuous period of time here at the state level, and we won't even get into the federal government yet, but at the state level, in fact, I was texting with our state representative, and she was up until 4 a.m., Representative Wirtz, reviewing the budget, looking at the language that was being passed and forwarded to her from leadership. And we avoided a government shutdown for the state of Michigan, but that was not easy. Walk us through the process, what was at stake, and how healthcare fared in all of that, if you would, please.
So we were in very good shape budget-wise. Every year, the executive, which is the governor, makes a recommendation in February about how to do a budget. And then, what does it say? The other saying, man proposes, God disposes. It's kind of like the executive proposes and the legislature disposes.
Yeah.
And so Governor Whitmer proposed her fiscal year 26 budget last February of 25. And everything that we were appropriated this year was in her budget for we are in fiscal year 26 now. Everything she appropriated for 25 was in the budget for fiscal year 26. And that was great news. And then the legislature took a look and started working. The Senate passed a budget that was very similar to what the governor did. And so we were pleased with that. And then the House passed a budget that made some of our funding precarious, absolutely precarious, and in a way that we were deeply concerned we would be able to maintain the level of funding that hospitals need to provide services to our patients. And it was more than $2.5 billion that was at risk.
Yeah.
And that was a deep concern. And we really kind of pulled out all of the stops for helping people understand that, asking constituents of our hospitals to reach in and lean in with their lawmakers and let them know how difficult such precarious funding is, and ask them to restore that fully. At the same time, there were some other issues with federal matching for Medicaid, unrelated to hospitals, but related to Medicaid managed care plans. And that was a big hole in the budget, a frightening hole, a $600 million hole. That's in addition to the $2.5 billion plus that hospitals had in this uncertainty. At the end of the day, the hospital funding was continued from the fiscal year 25 level to the fiscal year 26 level. We didn't get any increases, but we did not request any. So we're very pleased with that outcome. Everything was restored, not just our state-directed payments, but also special payments to support physicians who serve Medicaid patients, special payments to support maternal and infant health through some programming at the state. And we did miss out on some funding for following up on what's happened with reimbursement to hospitals for services that have already been rendered to incarcerated persons. We didn't win on that one.
Yeah, that was tough. Yeah.
But we're still working on that, and we still have a chance for that in a supplemental. So, I got to tell you, I was stunned at how readily this all came together. Now, I had a chance to talk to some people who were very much in those high-level meetings among the governor, the speaker, and the Senate Majority Leader, and it didn't come together nice and neatly, but it came together, and they were all committed to getting this done. The governor and Speaker Hall found common ground. I am extremely grateful for that, for both of their willingness to do that. I'm extremely grateful to folks like in your area, State Representative Jennifer Wirtz, State Senator Joe Bellino. They were among many who said to themselves, we've got to figure out a way to fund our government and do the work that people are expecting of us. And so the ease with which the budget actually came together, fully funding everything that is needed for Medicaid for fiscal year 26, it was really remarkable. And I think we're all very grateful. And I want to express, JJ, great gratitude to, we had 10,000 different people make a phone call to their state rep office.
Yes.
We had 1,500 people send an email. If you were one of those folks, thank you. And don't be surprised when we start asking you again.
Yeah, and a lot of our viewers reached out to me during this period and said, hey, just want to let you know I contacted so-and-so, and I got a tremendous amount of emails, text messages, and phone calls saying we just spoke out. We need to keep our local hospital for years to come. And so they were very engaged in this process. And I want to thank our listeners for the advocacy that you did. And then, shifting, Laura, talking about the work that you did and your team. I recall sitting around a boardroom table with, the director of the state budget, as well as MDHHS leader, you, me, MHA members, Brian Peters, Jason, the whole team from MHA that did a phenomenal job at elevating hospitals like Hillsdale, but really advocating for all hospitals. And thank goodness it did work out. And we would be remiss, to your point, if we didn't thank those leaders who stood up in the 11th hour and said, we have to restore this. We have to make sure. Now, the challenge has been, Laura, is that as that happened, I had a lot of people reach out to me thinking that we've solved this federal issue, that because the state passed this, that we're not going to take these cuts to Medicaid in the future that were projected by 2032. True. This only impacts the state of Michigan budget.
Right.
Essentially, they're not accelerating what the federal government's going to do by 2032. It kind of stopped that acceleration, but we're still subjected to the federal, which we'll talk about in a minute. But I really wanted to have one quick discussion about what you forecast in the next year that the challenges will be for hospitals like Hillsdale as we look to the legislature to fix some of these issues. And one of those issues, Laura, that we're battling is the drug pricing program called 340B. And that brings about $1 million to Hillsdale Hospital for much needed services for our community and reimbursement for patients who need critical medications. Can you talk to us a little bit about that and what you're anticipating with that legislation?
Absolutely. So the 340B program is a program designed to help hospitals purchase drugs more affordably and then use the savings that they reap from that to assist people in need, patients in need in their communities. And so that has been extremely successful. In some circumstances, it's really the difference. And I don't want to say that I'm talking about Hillsdale because I don't have any knowledge of yours
Sure.
financial situation specifically. But some hospitals, it's the reason that they can stay open is that they are able to purchase these drugs so inexpensively and then keep delivering services to their community through their emergency department and outpatient and even inpatient and surgical services, et cetera. So it's a very big deal. And we have some motivated adversaries out there that are poking relentlessly at the nonprofit status of hospitals, and they use this program as evidence of the deservedness or lack of deservedness of nonprofit status. The pharmaceutical drug makers are poking at what they would refer to as hospital mismanagement of the program. They imply that there are some hospitals that are in the program that shouldn't be, those kinds of things. So it's a very tenuous time for the ability to protect and defend those hospitals who use 340B to help their patients, help keep the doors open, help keep the services going. And let me just drop in, I know this isn't really what we're talking about specifically, but let me just drop in what we always like to remind folks is, if you were to lose certain funding and you could not continue, for example, labor and delivery services, you're not going to say, I can't continue delivering those for patients who use 340B drugs or patients who use Medicaid for their coverage or patients that live on the, odd numbered side of the street. It's going to close for everybody. And so that's why it's so critical that we keep things going for everyone, regardless of what the circumstances are. So we're working hard to push forward with the legislation to protect the relationship that your hospitals and any 340B hospital has with pharmacies that we call contract pharmacies that help you deliver those drugs to patients. And the drug makers have been pushing very hard against that protection. But we haven't given up on that, and we continue the advocacy necessary to keep this alive and hopefully moving.
Well, congratulations to you and your team, Laura, in government relations, because I'm here to tell our listeners that none of this would have happened. The victories, the successes we had it not been for Michigan Hospital Association advocacy. Bottom line, there is no other group going and fighting for healthcare in the state of Michigan other than the MHA for a collective group. Now there are just for this nuance or that nuance, but MHA going to the table representing all the members. I'm going to submit to you that none of this would have been accomplished had it not been for the late nights, the numerous meetings you've held, both in Lansing as well as in districts of some of these legislators, calling them, emailing them, working with them. I know you were with me and my legislator, on numerous occasions. We've had Zoom calls, and we've really had a discussion about why it's important to preserve healthcare. So it was a victory. Congratulations. We're not out of the woods by any measure at the state level because we do have this threat of 340B. We always have the threat of things like nurse staffing ratios, which you were successful in shooting down. But those things can creep back up, and we're watching those, the CON, all those things. But for now, we can say congratulations, job well done, MHA team, phenomenal victory for rural healthcare. That's in the state of Michigan. So take your bow because it's well earned. And now we shift to something a little more tense because now our shift goes to what occurred in the passage on July 4th and the signature of the One Big Beautiful Bill, in which Medicaid was really the target of that legislation. I know there's lots of misinformation about what the target was, but I'm here to tell you, as the president of Hillsdale Hospital, that we were truly impacted by this piece of legislation that targeted a reduction in how much our hospital is going to get paid to serve the Medicaid population. And remember, prior to the average commercial rate, that's what's really been taken away from us by 2032. That is the difference between a hospital being profitable to be able to maintain a margin to keep operations and the programs moving forward, and a hospital closing their doors. And the reason for that is because in rural communities like mine, 70% of my payer mix is the government. It's Medicaid and Medicare. 70% of my population in obstetrics is Medicaid. And so when we look at any cut to breaking even, which is what we're doing with Medicaid right now, we're breaking even and a little bit above that, almost to that Medicare rate. If you take away 8%, 2%, 3%, doesn't matter. Hospitals then lose their margin. They start to have operating losses. And this is where, I'm with Scott Becker from Becker's Healthcare. He'll be on our podcast later in the month. And I just spent yesterday with Scott. We've spent a lot of time talking with Scott about what the forecast is under the One Big Beautiful Bill for hospitals. And here it is, closures. Projected 800 hospitals will close in the next several years as a result of this, because it's the way hospitals receive reimbursement, Laura. And what I want to be very clear is, because the talking points right now are, oh, they're just using a scare tactic. You know, the JJs of the world are using scare tactics to scare people that you're losing your Medicaid. It's very true that you may have your Medicaid card, but the issue becomes, where will you receive the services if your local hospital doesn't get reimbursed enough to cover the cost of delivering the service? And that becomes the issue of why we're seeing today more closures, just announced last week, of obstetric programs across the country. Even in Michigan, one announced even a month ago of OB programs are closing. In Coldwater, just 26 miles from us, closure of the obstetrics. It's happening across the state. It's happening across the country. And the issue is the way hospitals receive reimbursement to delivering the care to this population. So I know that's my soapbox, but I want to be very clear. There's a lot of talking points about fraud, waste, and abuse. There's a lot of talking points about many other things that are being said today that are not accurate. Hillsdale County isn't serving a disproportionate share of illegal aliens, as it's been reported. In fact, I had our accounts manager pull me the accounts. We haven't served any of that population in the last year. So you're going to cut my Medicaid population because of this threat that exists where? It doesn't exist in Hillsdale. So we're taking this broad brush approach to eliminating healthcare in Hillsdale County because we want to use this tactic of fraud, waste, and abuse. It's very discouraging. But here's the deal, Laura. The train has left the station. The bill passed. Now what's happening for our hospitals in Michigan and across the country?
Sure. So the good news is that the worst of the cuts are delayed a little bit. You know, that was very politically savvy to say that the direct impact won't be seen until January 1, 2027. That's when it all really starts. But as you know, as a hospital CEO and anyone who's got this experience, maybe you're on a hospital board or, you know, have other familiarity, hospitals make plans 5 years out. You are looking right now at your capital investments for later. And my understanding is that capital expenditures, hiring, anything that requires new dollars is under intense review. And probably won't be happening because of the pending reductions in reimbursement to hospitals.
Absolutely.
So it happened right away. Everybody's like, well, it doesn't happen until after the next election. That's really not true. Hospital boards, hospital CEOs, hospital chief financial officers, everybody's looking at their financial situation right now in the context of losing across Michigan $6.5 billion over the next 10 years.
Yeah,
So
six
that's the reality.
billion. That's
That's
billion
just
with a
Michigan.
B.
That's just Michigan, right?
Just
Exactly.
Michigan.
Yeah.
Now,
And
go ahead.
we are so it really puts it throws cold water on the ability of hospitals to improve their services through investment. I mean, everybody's always working to do better care with the staff that they have, but if you needed to replace an outdated piece of equipment, that's a capital expenditure that you're probably rethinking right now. How am I going to make that happen? What else has to shift away if I don't? I would concur with you that this idea that somehow there's all kinds of waste, fraud, and abuse in hospital financing. We have a lot of motivated adversaries who like to push out that message, and they've been amazingly successful. It's inaccurate, is a polite way of saying it. And I encourage anyone who has some questions about that to reach out to your local hospital. One of our other board members said she had somebody in her community who would write op-eds and everything. And she finally said, I'd like you to come and work with me for a day. I would be happy for you to see where we're spending our time and where we're spending our money and what the decisions are that we're making. And, there's nothing really to hide. I want to reiterate that Medicaid is a very large payer, a very substantive payer for things like labor and delivery. Young women of childbearing age often have Medicaid as their resource for insurance. And that means that Medicaid on average pays about 50% of all births. If we were to cut a big chunk out of Medicaid reimbursement for labor and delivery, it means that the entire labor and delivery unit is at risk. And that means it's at risk for everybody, regardless of their coverage. It would go away for everybody. So we're very intensely evaluating the big bill, HR 1. We are sharing those messages about the changes that are already happening. And right now, for example, at the federal level, the reason that the federal government remains closed is primarily an argument over whether or not to continue helping people pay their health insurance costs under the Affordable Care Act, as it was designed to do, so that people can keep their coverage. We can't afford to lose hundreds of thousands of people off of coverage that might happen if we continue to reduce the support that we give them for paying those premiums. And everybody's required to carry insurance these days. Those premium tax credits help make that possible. It helps people healthy. They can afford things like their insulin so that they remain healthy and can go to work. And those are all really critical issues that we are confronting under the big bill. But confront them we will do. And, figuring out the ways to push back, delay any or prevent any additional cuts to healthcare, as well as try and regain some of our footing of the things that were lost in the big bill. We're very much focused on that as soon as we can get the federal government to reopen and they can be there to hear us.
Yeah. Well, and let's talk a little bit about that, because the understanding that when government shuts down, the impact, individuals might say, oh, it's okay, but the impact we're feeling in our respective communities. Because let's talk about the SNAP program. Let's talk about other programs that are important for everyday existence of our population. And I just want to say, we're fighting hard locally. I have directed our team to have some review of our food pantries in the community and make some decisions. I'm pleased to announce that we have a $5,000 donation going into the Salvation Army this week of non-perishable goods. I have made $20,000 in donations last year and the first part of this year for food banks that was divided up evenly of those food banks. We'll be making some more, and it's tough when your hospital has a very slim margin to be able to make those type of commitments, but it's important because individuals having access to food impacts their health and their well-being, and we know that. And so taking care of those core things that we need to do is something that I'm committed to in humanitarian effort, as well as understanding the value and the relationship that it plays towards individuals' well-being, to keeping them healthy. And so we've launched that, but there's a lot of communities that are suffering right now. And our hope is, I know that there's charitable events out there and charitable contributions that can be made. If you're listening today and you want to help out families, you can do that by donating to your local food banks. But Laura, that's a problem when government shuts down, is access to programs like this are impacted, correct?
Oh, you're so accurate. Um, our business leaders are deeply, deeply concerned about our education system, and are we meeting the needs of our students and our kids learning to read and all of those things. Absolutely well-deserved concern. We've got a lot of room for improvement. At the same time, we can't have kids go home to empty cupboards and think that they're going to be successful students. Food is health. If you're eating appropriately, then you're going to be, you've got a leg up. If we are saying to people, we've got an expectation that you're able-bodied and you work, oh, by the way, there's not enough resources for you to feed yourself, or you might be making decisions between drugs that you need for chronic illness versus food. Food is just imperative, right? I mean, we don't
Yes.
survive without it. So I'm really glad you brought up the SNAP issue. And it reminds me every year at this time of Harvest Gathering, I make a contribution in memory of my dad. And I'll be sure to act on that. I kind of had forgotten all about that. So I'm glad we had this part of the conversation.
Yeah. So Laura, let me ask, I've been out of it a little bit in terms of knowing did I understand that the governor has directed MDHHS to appropriate funding, or can you share some?
She moved, in the state budget. I don't want to make it sound like there's just like this extra swag in the budget and you can kind of just like find funding whenever you need it. What happens is that some programs that are planned to expend at a certain level, they don't quite get there. Some programs spend more than they were expected because they're oversubscribed. And so things are always kind of like moving here and there, as you can imagine, in a budget that has, like our $13 billion general fund. And she's managed to find some of those places where there were funds that weren't going to be expended as originally intended and push those into addressing the food insecurity that's happening because of the federal government shutdown. I think all of us can do our part. It was a large, I think it was $4.5 million, but I'm not sure that that's anywhere near enough to make up for the difficulties that are happening for families around our state right now. And my heart just breaks for any kids. Parents too, of course, but just the idea that, we're sending kids to school and, that they're so dependent on lunch and breakfast at school because their families are just not given the resources necessary. And these are working families. Like, let's be clear, these aren't folks, unless they're people with severe disabilities. These are families, these are supplemental nutrition dollars. They're not what I'll call welfare dollars.
No, not at all. And I certainly personally know the value of free lunch, having left our home many times, of a very large family, very poor, having gone to school as my only meal. And the value and impact of that to my health and to my well-being was critical. And so I always give back very generously for food pantries and for programs. We have opportunities that we like to support programs like this. And I would encourage our listeners today, if you're listening today and you need assistance, there are services available. You can Google those services, but I can tell you Community Action Agency, Salvation Army, King's Cupboard, there are so many resources available that we as a hospital give to them and then they distribute. And we've worked with them in numerous ways, whether it's we've dropped off the goods that we purchased from a local vendor. We used to have a Healthies program that lasted 2 years for fruits and vegetables, that we would
Mhm.
deliver fresh vegetables, and working with local source farmers to provide that. Now it's more of the non-perishables that we're distributing, but we're coming up upon Thanksgiving. If you're out there and you need those services, they are available. We're going to continue to support those to the degree that we can. Individually, I would encourage those listening. This is a time of giving, right? As you make your decisions on where you're going to reallocate your donations, I would encourage you to please consider our food banks in Michigan and Hillsdale County, respectively, but people listen to this program throughout the country. So if you're in a community that has a foundation that you can give to, if you're in a community that has a action agency or food pantries, give consideration to dropping off groceries or cash, non-perishables or cash, to those locations, because we need to feed hungry individuals. It's so important. So as this government shutdown continues, and as we face some of these significant challenges, we can make a difference, every one of us, in giving some of those resources up. So I just encourage our listeners. Laura, it's been great to have you. We could talk a lot about all of the things that are impacting hospitals, but we wouldn't have the time. But I do want to commend you and your team for the work that you've done to safeguard hospitals like Hillsdale. As a result of your advocacy, our hospital can stand today. And I say that with all sincerity. There's never been a more pointed time in our existence, and that we have faced these tumultuous challenges. And what we have coined unprecedented fits this category very well. These are the most unprecedented of times that we never thought would happen. Shutdowns, no food access, hospitals being the bad guys as fraud, waste, and abuse, government officials being misinforming their constituents over what actually is happening. All of those are significant challenges that we never thought would happen, and it's truly unprecedented. But in the midst of this unprecedented time, I want to thank you and your team for the work that you're doing to safeguard our families right here in Michigan and in Hillsdale County. So, Laura, thanks for joining us today. It's been great to have you on the program.
Thank you so much. And same to you. JJ has been a fantastic advocate, and we've asked him from the MHA for many services: send an op-ed, do a podcast, speak to this reporter, be here in Lansing to do testimony. And I don't think you've ever said no. So thank you for your advocacy as well.
Yeah.
Appreciate it.
Well, I appreciate it. It's great to have a partner like you. So, to our listeners, thanks for joining us today. It's great to have you with us again. We'd encourage you to tune back in. We have so many opportunities for you to learn about rural healthcare, not just Hillsdale, but rural healthcare across the country. Our national podcast, Rural Health Today, wherever you subscribe to get your podcast, please subscribe to that. It's important that we get the message out across the country. We're hearing from hospitals in states I never would have dreamed that would reach out to us and say, can you help us? We're really challenged. And a program that has impacted their lives or their programs. We ran a maternal health program. I heard so many great reviews about that, and we had some great guests. So I encourage you, wherever you get your podcasts, please download that. And then you always can hear us on WCSR every Friday, 92.1. We give a hospital update. And in between there, we try to do these live events so that way we can inform you, the listener, in our communities, in whatever community you're listening, that we have advocates and resources available to help prop up your local healthcare. And that's exactly. But what we need from you is we need your advocacy as well. Number one, use your local hospital. It's so important. And number two, if you have a concern about your local hospital, go to their leadership and say, hey, these are the challenges we're having. There's a process that hospitals utilize. There's a patient advocate, there's a risk director. They'll mitigate all of those issues for you, and try to come to a resolution about how to make sure that the services that you receive are superior and that you continue to use them. Number two, you can prop those hospitals up, because most hospitals like mine that are rural are in fact non-for-profit. You can make donations to hospitals like ours. Our mission is so important and vital to our community. We are the economic engine of our community, pumping back tens of millions of dollars a year in the local economy. And if you want to make a donation, we're non-for-profit. We will make sure that it goes to places that have the highest need. So consider that. But the third thing that you can do, and the last thing, is lift your voice in the state and federal government. And the way that you do that is contact your legislative representative, whether it's at the Michigan Senate, the U.S. Senate, at the Michigan House, or the U.S. House of Representatives. Let your voice be heard and share with them your concern that rural hospitals like Hillsdale could cease to exist. We're 110 years strong this year. And what stands in the balance, thank you, what stands in the balance is funding at the federal level that will be cut to render services to a disproportionate share of Medicaid population that we have in rural communities. It exists. We're not going to get around that. But we have to have the support from the government in order to continue to fund those programs to ensure that people like me growing up receive the care that they need the most to be healthy. So thanks for joining us today. Stay rural health strong when you choose Hillsdale Hospital and rural health in your local community. Thanks for joining us.